With us, we have Dr. Ali Safayan, and he is a medical practitioner. He is a medical doctor, and we're going to be talking about medicine today, and specifically what he does in his practice, in which he is merging your standard care and standard medical approach to healthcare with some of the alternative medicine practices. Welcome on the show.
Thank you. Thank you for having me.
So we kind of chatted before about like some of the topics that we need to talk about, and I'm super excited because you brought in a couple of different perspectives on where we are with medicine and medical insurance nowadays, and what works, what doesn't work. And so I want to pick your brain, and I want to talk about like what you do in your practice. How is your practice different than what's happening out there in sort of like the standard field, and why does it work? And I realized that I just thrown out like 6 questions at you, so I'll let you choose what you want to start with.
Yeah, that was a lot. Well, my practice, I'll just start with a little background about myself, and then we can expand it into the actual practice.
Yes.
I started my training in Washington, D.C. in 1990. And within about 2 years, I was absolutely burned out with conventional healthcare. I was actually shocked that the majority of people that were coming to see me were simply interested in me filling their prescriptions that they've been taking for years and years and years. And no one had asked them, first of all, why are you taking all these medications? And secondly, does the doctor that you're seeing actually sit down and talk to you about these various medications? And in general, most of these people ended up on a medication that they'd been taking for several years without actually needing to continue to take it. But because they would just call the doctor, or the doctor was too busy to really understand or review their chart, and just told the nurse, for example, yeah, go ahead and just renew the medication, people ended up on these medications for years and years and years. And when you ask them why are they taking it, they really wouldn't know. And they'd say, well, this medicine I think is for my blood pressure, or this medicine is for my diabetes or my cholesterol. They didn't want to talk to me about, first of all, trying to get off the medications. And secondly, more importantly, they didn't want to talk about lifestyle change. They didn't want to talk about diet. They didn't want to talk about reducing their stressors, et cetera, et cetera. So by 92, I myself was stressed out and burned out. And I thought there's got to be a better way. And I can't believe I'm going to spend the rest of my life practicing this kind of medicine.
Right.
And I kept getting this brochure that came across my desk, and it was the UCLA Medical Acupuncture course for physicians. And the tagline was, "Fall back in love with medicine." And I thought, that sounds interesting. And I'd always been fascinated by acupuncture. I didn't know much about it. I had a stint in Southeast Asia, and so I had a little bit of exposure to it. And each 3 or 4 months, I would get this flyer that came across my desk. And each time it went by across my desk, it had increased $200 or $300. And I thought, wow, before this thing gets out of reach, I better take it. And I took it in 95. And it was such an eye-opening experience to look at medicine in a completely different way, to look at healthcare in a completely different way. I mean, it was just really, really brilliant. And that was the beginning. I did fall back in love with medicine, and I started to understand that, this conventional model, it's great, it really is. But I took the blinders off, and I said, there's more out there than just this. And that was the start.
So how was medical acupuncture? What did it reveal to a classically trained medical doctors such as yourself, what was so different and eye-opening in with acupuncture specifically that you said, wow, I haven't considered maybe this perspective or the knowledge that it gave you? Can you tell me more about like how do you see acupuncture? How did you see it then? How do you see it now? Is it still within your practice?
Oh yeah, it's huge. It's a huge part of my practice. Well, I'll give you an example. In the old days, prior to my medical acupuncture training, a patient would come in and they would complain about having sinus infections. They would also complain of having had maybe bronchitis every other year. And more recently, they would complain that they're starting to have irritable bowel syndrome, or they were diagnosed with irritable bowel syndrome. In the old days, these three conditions would have been completely separate states of being. They would have had no interconnection whatsoever. And their treatments would all three be different. They would have no connection. And I wouldn't treat all three of them together. I would treat them separately when the events occurred. With medical acupuncture, they're actually one and the same. They are on the same principal meridian. And if you actually energetically stimulate that principal meridian, you can treat all three problems and not just one at a time.
Right.
And you don't need medication. You don't need antibiotics. You don't need much of the things that we put into people. That doesn't mean I'm cavalier and I won't use those things when they're needed. But certainly when someone comes in and has recurrent problems like this, and they've tried everything else in the past that didn't work for them, I turn to medical acupuncture and I say, well, you've tried all this stuff, it didn't work. Let's see if this may help you. And that was the approach. And it worked. It was fascinating.
So you mentioned medical acupuncture. Is medical acupuncture different than regular acupuncture? If it is, how is it different? And for those who just vaguely know what acupuncture is, those who just know that it's a bunch of needles stuck in your body, can you describe in your own words, like, what is acupuncture and why do you think it works?
Yeah. Our bodies have an energetic system in them. Ironically, in conventional medicine, we don't talk about the energetics of our body. It's really sad, but we don't. But our bodies, our flesh, our blood, it has energy in it. Just as the lights are on here, just as I'm talking to you by way of the internet, this is all energetics. And our bodies have energetic capacity. And that's actually how we live. That's how we exist.
Right.
But in conventional medical care, we don't talk about the energetics of our system. In fact, doctors that talk to the patients about energy medicine, if you will, are considered quacks. Don't go see that guy, don't go see that gal. She's going to talk to you about energy medicine, and that's just woo-woo. That's just nonsense. It's hocus pocus. They're just going to take your money, and it's not right. And that's incorrect, because our bodies run on energy. So to discount it as the conventional medical model has is really inappropriate. We rely so heavily in the conventional model on physiology. In other words, how does my liver work, and is it working properly? And so I do a liver test and I say, sure, my liver is working properly, but how does my liver actually do that processing? It does it because the physiology is connected, if you will, to the energetics, the energy part of the system, which we do not talk about. We discount it, and we don't really study it. Acupuncture, as well as many other alternative therapies, actually tap into the energetics of our system. And because the conventional model has turned a blind eye to the energetics, then these alternative therapies, unfortunately, are discounted. And we're told that we're quacks and we shouldn't be practicing this stuff. What we do with acupuncture needles, if you look at the design of an acupuncture needle, I'll use this pen as an example. An acupuncture needle has let me put it right here. Whoop, let's put it over here. There we go. I've got to figure out exactly where to put it on this screen. Okay, so this part of the pen, let's say, is the shaft of the needle. This is the handle at the top that has a coil around it. They're two dissimilar metals. And when you put two dissimilar metals into an electromagnetic milieu, then you transfer electrons from one metal to the other. So this, actually, an acupuncture needle is a battery, because you're putting the acupuncture needle into the flesh, which is an electrochemical milieu, and you're allowing the two dissimilar metals to discharge electrons into the tissue.
Right.
And when you figure out exactly where the point is, and depending on which meridian you're on and what point you're stimulating, you can actually relieve patients' problems. That's a very simplistic description of how acupuncture works, but I think it conveys the idea. In terms of medical acupuncture, the difference between traditionally trained acupuncturist or licensed acupuncturist, a medical acupuncturist has to be an MD or a DO. And the course that I took and have been teaching for the last 25 years now is a course specifically designed just for MDs and DOs. We do not need to sit and take biochemistry and physiology and anatomy. We don't need to take pathology. We don't need to take all those things all over again to try to learn acupuncture. We already have that as a background in 11 years of training, which you all have to become a physician. So when you're already a physician, we've pared down the course in such a way that all we're doing is teaching what is known to work in acupuncture to medical doctors. So these are medical doctors that are using what is known to work in acupuncture, and they're trained in a 6 to 8 month period of time, very rigorously, I may add, just for this material. So if someone came to them and said, well, can you sit down and talk to me about the philosophy of the Nei Ching or the Yellow Emperor's classics, or can you sit down and talk to me about how the agrarian metaphor was used to develop the acupuncture concepts of energy and flow and obstruction? No, these medical doctors wouldn't necessarily, and some would actually, the ones that are interested, would be able to talk to people about that. But in general, that's not what they're being trained to do. They're being trained to use what works in acupuncture to help people in their practices.
So that's very focused on practical aspects of delivering the results through the acupuncture technique. Again, for those who don't know, what is a meridian in your body? And what is actually happening? And what is actually happening other than the transfer of the electrons through the needle, right? That needle is going into your body, is going into your skin, and those electrons travel down over there. They connect with the meridian. And what do you think is happening? I mean, it's delivering energy, so it's affecting that point. But what is the meridian?
So it's unfortunate that you and I didn't go think this through a little bit more, because I probably should have taken some pictures and sent them to you. And I don't know if this will actually project, but I do. Let's see if we can get this on here. Probably not going to do well.
Bring it a little bit closer, maybe. Let's see. Oh, something is coming out. Yeah, I see something over here. So I see a sphere and what looks like a little person.
Let me take. Yeah, well, that's it. It's here. Give me 1 sec. Let me pull this iPad out of this.
So for those of you who are listening to this show, I'm going to try to describe in my layman's terms what I'm seeing, what Dr. Ali is showing us over here. So we see what looks like some kind of a circle, which is maybe a cell, and then next to it, it looks like. Can you actually? You know what? Why don't you comment what I'm looking at?
Yeah. Okay.
Mm-hmm.
So you see those three lines that one says ecto, one says meso, and one says endo?
Yes. So 3 stacked layers.
Uh-huh.
Mm-hmm.
Those are called the germinal layers. And this is how a baby is formed. This is how we were all formed. Those 3 layers then become a circle. That circle is called the neural tube. And then that circle, as the baby forms, you can see the head bud and then the limb buds push out. But all 3 of those different layers go into the limbs and into the head.
I'm with you.
Right? And then here we have those 3 circuits, if you will. Those 3 circuits that you have there are the circuits of acupuncture. Those are the meridians, if you will. And each one of those meridians has a relationship with one of those germinal layers that we are born with.
Okay.
So those, if you will, those are the meridians, and they come from the germinal layers that we have from birth.
Okay.
So this, so conceptually, and it's not a one-to-one correspondence. It's not, because, I mean, the bottom line is you're talking about an art that its oral tradition is probably 5,000 years old. Its written tradition is probably 2,000, 2,500 years old. So a lot of acupuncture to this day, how it was developed, how it was disseminated, it's so much of it is still conjecture. We don't know how they figured this stuff out. I mean, that's just impressive. And for me, something that's been around for 5,000 years, there's not too much in human history that has been around for half of human existence and is still here today and is still practiced. So to discount acupuncture as hooey-pooey or voodoo medicine, and to discount the practitioners of acupuncture, especially the ones who have studied it for years and years and years and honed their skills, and can treat some of the most bizarre things just by using a few needles, it's really unfortunate. It's very narrow-minded thinking on the part of my colleagues and the establishment, medical establishment.
So what happens when that needle hits the meridian and delivers that energy? What do you think is happening that has an effect on the human body, on the patient? So this goes conceptually then to the idea of flow. Acupuncture, we believe, is an agrarian metaphor. The people that worked the fields understood that if there was water running down a canal and it flooded into a field, then whatever was in that field would grow. But if you obstructed the water to get into the field, then the field would die. They applied that same concept to their own bodies. If you have an obstruction in your arm, whether it's trauma, whether it's break, whether it's infection, whether it's some sort of inflammatory process, and this part of the arm is not getting fed, if you can relieve that obstruction, then you can repair the part of the arm that's not working. And that's the logic behind acupuncture. So you find where the channels are going into the damaged area, and then you put needles before the obstruction and after the obstruction, and then run electricity through the obstruction in an attempt literally to try to blow out that obstruction out of the way and get the energetics to flow back through there. Again, very, very simplified answer to a far more complex
complicated concept, but I think you get the idea across.
Yeah, and that's what I appreciate about talking to you. You have a really good skill at good analogies, good visualization, and in layman's terms, explaining how things work without overcomplicating it for us.
I'm actually known as I'm known as the drawing doctor, because I have on my exam table, you have the exam sheet that it pulls, so I just use that as a drawing. It's just my drawing table. So I start at one corner of it and I just draw, and people tear off the sheet and say, "Can I take it home with me? Would you mind signing it?" And then I just sign and fold it up and I give it to them. So, and it makes it a lot easier. Well, because it makes it a lot easier for them to go home, because they go home, they sit down with their significant other or whoever, and they go, "Well, how did it go with that doctor that you went to see?"
Right.
I had a guy that came in today with his wife, if you don't mind me giving an example, but he comes in with his wife, and they came, from a good 40 miles away, and the wife has been to the emergency room now since November. She's been to the emergency room 11 times. And she's seen a cardiologist, same cardiologist, about 4 times. She's wearing an event monitor on her chest to monitor her heart function for an entire month. She's seen a neurologist. She's seen the primary care 3 times. She's been placed on a whole bunch of medications. And the bottom line is, between 12 and 2 a.m., 3 or 4 times a week, she gets up with a fright. She's got massive palpitations. She has shortness of breath. And she essentially, if you will, this is what they're calling it, a panic attack. And she winds up calling 911 and going to the emergency room. And in the emergency room, they don't find anything wrong with her, and they send her out and give her some other medications. And this has now, again, happened numerous times. And one of my patients who works with this woman said, "Well, why don't you go see this guy?" So the husband is sitting with the wife, and the wife is very pleasant, but obviously in distress. And he's clearly not interested. I mean, he's like rolling his eyes. And at some point, I asked him, I said, "Well, this must be very disturbing for you as well, because, this is your wife, you're concerned, et cetera." He goes, "Yeah, it's disturbing, but what's more disturbing is I'm not sure why she's here to see you, because there are plenty of other doctors in our area that she could have seen. So I'm waiting to see what happens here." Right. And so this is unfortunately the sort of thing that you run into not too infrequently, because people are unfortunately still very suspicious of what we do in this so-called complementary and alternative medicine, this acupuncture stuff. And so that gives you an example of the attempts on the part of someone like myself to try to bring someone like that into, if you will, focus, to understand something like I just explained here. So I sat down on my piece of paper and we went through a diagram. And very interestingly, that time period energetically from the time that she has her problem is a time where our body has a cyclical, obviously we have a 24-hour cyclical energetic pattern, right. And that's nothing new to anyone. Everyone has heard about their circadian rhythm, et cetera. So that's nothing new. But in acupuncture, there are 12 organs. And each organ has 2 hours of energetic stimulus going through them. In this lady's case, the time between 12 a.m. and 3 a.m. is when energetically the liver transfers its energy into the lung meridian. And she actually has an energetic obstruction there. And I didn't want to, kind of blow them over with this information, so I didn't. So I gave them some other thoughts, and the guy at the end was very pleased with his almost hour and a half visit with me, and his wife got some basic needles put into her ear, actually, because she was very frightened with needles in general, and so I didn't want to traumatize her any more than she already was. And at the end, when she left, she was far more calm and far more engaged. And I'm curious to see what happens to her when she comes back in about a week.
Right. You must be the first doctor that I know who is using, visuals in terms of, I've seen people like pointing out to some, teaching aid or, something that's pre-printed, but using the paper that you lie on to kind of illustrate what's happening in sort of real time and explaining it. I think that's a very valuable thing. Just because a lot of people are visual, so they appreciate the time that you're spending to explain to them, and B, just kind of visualizing what is actually happening, so that it doesn't, they register better. So that's something definitely new and interesting that you're doing.
Well, I teach. I've taught acupuncture now for 25 years, medical acupuncture. I've taught prolotherapy, which is another technique that we can talk about at some point when you like. But I've been teaching prolotherapy for about over 12 years now as well.
Right. And, so I'd love to learn about that, but I have a question that I want to ask you before I forget. What is the difference between medical acupuncture and, I don't know, what other acupuncture is there?
Yeah, so there's many, many, many types of acupuncture. So, for example, there's Korean hand acupuncture. They're little tiny needles that, can you imagine, they put into people's hands.
Whoa.
Right? So if I put my hand up here, that's my left leg, that's my left arm, that's my head, that's my neck, this is my body, this is my rectum down here, this is my right arm and my right leg. This is my hip joint, etc.
Right,
this would be the front of my body. This would be the back. That's just Korean hand acupuncture.
Right. So for those who are listening to this as opposed to watching, Dr. Safayan is basically mapping out your palm. So if you can imagine a palm, your open palm, and middle finger is basically where your head is on top of the tip of the middle finger, and then the corresponding fingers are kind of representing the left and right side of the body, and then the bottom of the palm, the bottom of your body.
Yeah, and the crazy thing about it is you got the right hand.
Mm-hmm.
And then you got a left hand. And then they do this. So you can treat, they line up with each other like this. So depending on the patient's problem, you can treat the right hand or you can treat the left hand. If you want a big treatment with a lot of juice, you basically treat the problem on both hands.
Wow.
And how can you do that? Why can you do that? Is because of what I showed you before in the drawing of the ectoderm, the mesoderm, and the endoderm, and that neural tube and the limb buds that carry the three germinal layers into our extremities, into our head, into our legs. So all three germinal layers that have not only energetic capacity, but they also have physiologic capacity, go out into our extremities. And all we're doing with acupuncture is stimulating them. Body acupuncture uses basically the body. Korean hand acupuncture is only using the hand. French auricular acupuncture is only using the ear. There's also Chinese auricular acupuncture. There's Chinese scalp acupuncture. There is Japanese Yamamoto new scalp acupuncture. There is French energetic acupuncture, which is the technique that I use, which incorporates much of conventional, if you will, acupuncture. And there's this thing called TCM acupuncture, traditional Chinese medicine. This is quite fascinating. Many people think that because the name says traditional Chinese medicine, that this is the stuff from 5,000, 2,000 years ago, and it's actually not. What happened after the revolution in China and the inability, because it was a poor country with huge population, they didn't have doctors and they certainly couldn't afford Western medicine. So what they did, they had an army of barefoot doctors. They took people, anyone that was willing to learn how to do acupuncture and herbs, and they put them in school for essentially a year, and they taught them how to use acupuncture needles, how to use herbs, and then they gave them a pack and they put them out into their communities. And they delivered healthcare for decades like that.
Amazing.
They were the barefoot doctors. They were the originators of TCM. It was those people that immigrated to the States back in the 60s and the 70s and started all these various schools around. And as you know, unfortunately, education is a big business. There's a lot of money to be made. And these were people that they had maybe 1 or 2 years of training only. And now if you want to go and get licensed as a traditional Chinese medicine physician, you are going to have to take at least a minimum of 3, sometimes 4 years of education. And so I often wonder, wow, what have they added to all of this to kind of, I hate to say it, string these people along for 4 years before letting them out and taking all this money from them. But that's the way it is.
Right.
And then there's another body of acupuncture that's called Wesleyan or 5-element acupuncture. So
how do you choose between all of those different ones?
Exactly, right, exactly. How do you choose between those? And so that's why we created that's why the French energetic school of acupuncture came about, that said, okay, what we're going to do is we're going to take the concepts from all of these other disciplines of acupuncture. We're going to try to figure out the things that we know work. We've seen them work. There's legitimate studies behind some of them. Unfortunately, the studies are at this point now, the studies are quite old and they need to be redone. But the fact is that there was a time where you could provide studies in acupuncture. Today, because there's no money in trying to do studies for acupuncture, who's going to do it? I mean, acupuncture is cheap compared to, let's say, a new drug for chemotherapy, right? Takes billions of dollars to get it through the pipeline and 10 years of research, R&D, et cetera, et cetera. So you've got financial backing for something like that. Well, who's going to back acupuncture? I mean, acupuncture is a bunch of acupuncture needles. They're, maybe about 100 needles cost you $20. And the rest of it is just the knowledge of the practitioner applying the trade on the patients for the patient's problem. That's it. So this idea that acupuncture needs to be studied to an extent to prove its merit, although I believe it and I understand why in the conventional model they need it so that they can claim that it has legitimacy. For me, it doesn't need to have legitimacy because I've seen it work. It's been around long enough to show its merits. So to have to constantly claim that, we need more evidence-based or scientific-based justification to use this stuff, I kind of get tired of hearing that.
Right.
So that's the difference between medical acupuncture and, if you will, conventional acupuncture. I think the biggest thing that medical acupuncturists have going for them is the fact that we've already had minimum of 11 years of scientific and medical training before we do the acupuncture part. Right? So we can order laboratory. We can examine patients using fairly sophisticated diagnostic equipment and allowing the acupuncture as an additional tool for the medical doctor to use makes that doctor a pretty powerful doctor. But when you're going to a TCM or licensed acupuncturist, it's not to belittle their education. They've had fine education and they will be fine acupuncturists, but that's a limitation. That's all they have. They've got one tool and it's called acupuncture. They don't have the capacity to order labs. They don't have the capacity to use diagnostic studies. They don't have the capacity to interpret and utilize the laboratory to the benefit of the patient. They have to have a medical doctor or someone else to do that for them. They can only provide acupuncture.
Right. I'm tracking. So what have you seen? I'm really curious. What have you seen in, let's say, hypothetical case of someone who has 3 various symptoms like you described? Someone has, let's say, sinus infection every year, and then they have bronchitis, and then they have, what was the third thing? Was it something with liver?
IBS.
Okay, IBS, yeah. So irritable bowel syndrome, and then you do lab work before the acupuncture. You do lab work after acupuncture. Their symptoms dissipated. They feel better. What has changed in the lab results?
The lab work's not going to show you anything unless they have an active infection or something like that.
Right, something that's measurable.
Right, that's measurable. Because again, remember, acupuncture is working at the energetic level. We don't have a mechanism to test people's energetics, but we have a very simple test. We just say, Adrian, how are you?
Do you feel better? Yeah. Do you feel better?
Simple as that. Adrian, how do you feel? And if Adrian says, I still feel like shit, then you go, okay, well, I've got to do something different. But if Adrian says, doc, I'm not sure what you did last week, but man, I felt great for about 3 or 4 days. And then it started to slowly come back. And, I'm now about, let's say, I felt like I was 80% better. And I'd say I'm about 60% better. Wow. Now that's an improvement, because this is a person that was having sinusitis. This is a person that was having bronchitis. This is a person that's having IBS. And I moved the ball down the field for him or her.
Right.
So they come back and we do another treatment based on their feedback. Once I get the feedback, I can either do the same treatment, or if I didn't get what I was looking for, I can modify the treatment based on the feedback.
Right.
So there's generally not measurable there's not an X-ray that I can do, or a diagnostic study that I can do, or there's not a way that I can do a lab test that says, oh, look, their hemoglobin improved with that one treatment you did last week. It's not measurable in that way, and that's why the conventional model loves to criticize acupuncture, because it's not measurable in so many ways. So when we try to apply the scientific method to so much of this energetic stuff, it doesn't work because it can't be measured in that way. And this is the frustration of the people that work this, if you will, that provide these types of therapies. It's our frustration, and it's fodder for the critics, the naysayers, to say, well, it's nonsense. It doesn't hold muster.
Right. Well, maybe it's right. Maybe it's because we just don't have the tools to measure it yet. Maybe that's in part.
That's exactly that actually is the problem. We do not have the tools yet to measure that.
Right.
I mean, there are a lot of people around the world that are trying to figure this stuff out, and there are tools out there. The problem is that many of them actually are considered illegal in this country. Right?
Really?
They're not FDA. Yeah, they're not FDA approved. For example, there's this thing called a Rife machine. I don't use it. I've never used it, but it's a machine that actually allows you to put energy, if you will, into acupuncture meridians and into the body as a whole. It can diagnose, or the claim of the manufacturer is that it can diagnose and treat at the same time. So there's a lot of this energetic machinery out there.
Right.
The FDA hasn't given its blessing on it. And in some cases, the FDA said, yeah, that's nonsense. You can't use that machine in this country. Get it out of here. So people sneak these machines in all over the place, and they use them. I mean, people have these things in their private homes, and they've learned how to use them. And many people claim that, they get better with this stuff. Okay, well, as long as it doesn't hurt you, I guess it's a good thing.
It's very interesting. Going back to what you said about energy and body being an energy system, the analogy that comes to mind is troubleshooting a car engine. When you have fuel problems, when you have energy problems, energy distribution in a car, that's where you look, because that's where you look at, right? You look at how the transference of how combustion works, how that energy is being distributed, and all that stuff, right? You that's the first thing that you would look at, and body being obviously a vehicle that utilizes energy and It's amazing. It's astounding that we're not spending more time trying to figure that out from that respect in a more, like, I guess, scientific and methodical way. So it's curious.
I mean, to use the car analogy, so your lungs are your air filter. It's the air intake. Your carburetor is the heart. The fuel that's coming in is your gastrointestinal tract.
Right.
And basically your exhaust system, if you will, is
your exhaust system.
We know where the exhaust system happens to be. So it's so odd to me that we make the human body, believe me, the human body is incredibly, beautifully, elegantly complex. But we can also really make it simple and work with the simple model and help people out a lot. We just don't. We want to make it as complicated as possible because we want to show our worth, right? I want to make sure that people know my worth to them and that if I'm going to get that $20 copay, that I deserved it, you know?
Right.
As crazy as that.
Yeah. So is acupuncture the thing that started you on the path to combining traditional medicine with the alternate medicine on that path?
Yes, okay. It was. It literally took the blinders off. For me, conventional medicine was like this. There's nothing else. You always have to look at the patient like this. I took the acupuncture course, and I was so astounded that there's a different way of looking at us. There's a different way of treating us. And the outcomes are better, and you are not harming people with potentially, with chemicals and with drugs. Again, I'm not cavalier. If I need to put someone on a blood pressure medication, an antibiotic, if I need to put them on a cholesterol medicine or a diabetic medicine, et cetera, or an inhaler, I am not cavalier. I'm a medical acupuncturist.
Right.
But when someone comes in and they've completely failed so much and they've had so many side effects, I still have a tool to provide them. In the old days, I didn't. I had this. And if they'd already seen 4 or 5 people and now they were coming to me, there was nothing else that I could give them except maybe try a different inhaler or a different blood pressure medicine or a different diabetic medicine, something like that.
Right.
But once I learned the medical acupuncture, I gave them something that never had experience with before, and I started getting people better. And that's how it all started.
Do you believe that alternative medicine, well, two things. A, I wanted to ask you, like, what is your definition of alternative medicine? Because when you look it up on Wikipedia, it's quickly put in the same, described as pseudoscience, which gives you this impression of some kind of woo-woo. It's almost in a pejorative meaning, that sense of alternative and pseudoscience, which is magic and potions and whatever else, right? And homeopathy is definitely put into that. Even chiropractic is put into the pseudoscience group. How do you define alternative medicine? What does that mean to you? How do you define it as compared to your conventional medicine?
Yeah. So conventional medicine is allopathic medicine, and conventional medicine came about.
Like, explain what allopathic means.
So allopathic means, so let's go back into the late 1800s and early 1900s. During the time where we had the industrialists, right? And they were starting to understand there's probably money to be made in this drug business, right? So there was a report, and I don't remember the year, but it was either late 1800s, early 1900s. It was called the Flexner Report. And the Flexner Report came out and basically said that anything that is not allopathic in the United States could no longer be practiced. And the definition of allopathic medicine is that you take a patient that has a complaint and you take their symptoms and you categorize their symptoms, and you, if you will, you put it through a process where whatever grouping of symptoms seems to work best together is then given a particular diagnosis. So the person that comes in and says, I've got postnasal drip, I've got yellow-green mucus coming out of my nose, I have a frontal headache, I've got fever, and I've got swelling in my neck, that constellation of symptoms would be, in allopathic medicine, it would be called sinusitis. And then there would be a treatment for sinusitis, which would require a drug or something else that either the pharmaceutical industry or some other, if you will, production house created something for that thing, that grouping, if you will, that constellation of symptoms that the allopathic medical model calls sinusitis.
Right.
And if you were practicing homeopathy, if you were practicing acupuncture, if you were practicing herbs, none of that fell into the allopathic model, and consequently all of that was basically thrown out.
Gotcha.
And the Flexner report then allowed the industrialists to start the whole pharmaceutical industry, and we kind of know where that's led us.
Right.
And again, I'm not anti-pharmaceutical. I'm happy to say that I'm glad we have pharmaceutical drugs because they do have a purpose and a need. We need them. The problem, unfortunately, is the expense is getting totally out of control. It is totally ridiculous. I just had a patient that came in recently with an autoimmune disease, and the drug, and they were having problems trying to help them, and the drug that they want to put them on is $16,000 a month.
What?
I mean, it's like
What?
$16,000 a month. I mean,
That's incredible.
16,000. I'm like, what? I mean,
What is it made out of? Small diamonds?
I don't know. Honestly, I don't know. I'm mortified. I'm not sure how the pharmaceutical industry sleeps at night when they put price tags like this. Don't get me wrong. I know it's research and development dollars. I get it. I know it's 10 years. I get it. I know they got investors. I get all of that. But at the end of the day, who can afford $16,000 a month for a drug? Not the average American. Well, not the average human being. I mean, there's the only people that can afford it now are wealthy people. That's it.
Right.
Anyway, that's shameful, and I have a problem with that.
So that's the allopathic, that's the conventional medicine approach, and then everything else was basically just bucketed into the alternate medicine.
Yeah, and I have an axe to grind with this whole holistic, alternative, complementary, integrative. All of these terms are attempting to describe anything that's not allopathic. And in order to sell themselves, they change it up every couple of years. So it started out at one time as alternative. Then it became holistic. It was softer, if you will, because alternative is kind of bizarre when you think about it. Because alternative means you got this option, and then you got this option. It's an alternative.
Right.
It's not like you can somehow blend them. Then the concept became holistic. We're going to look at the whole person. And then we started talking about integrative medicine. We're going to try to integrate these two things. So although I've been labeled as an integrative physician and I've had to describe myself as an integrative physician so that people understood what I did, I don't necessarily buy these definitions. I think the medicine that I practice, the medicine that I teach, and the medicine that I hope is the direction that we're going into is taking what we can that we know of all the different aspects of healthcare. Take all the different aspects of good healthcare that have been studied legitimately and we know them to work. We use all of that. We provide all of that to all of our patients so that we don't skip. And I think all good physicians should have all of that expertise. We should not be narrowing our focus. Now, that may mean that we have to make medical school, instead of 4 years, it may mean you got to take it 5 years or 6 years. Or there's some aspects of medicine that we don't necessarily need to kill our medical students with. You know, I hate to say it, but there's aspects of medicine that we are now, it's right here, right? The kid doesn't need to sit there in pharmacology and try to memorize 500 different drugs. It's all right here.
Right, you can just look it up as reference on whatever medical reference database.
I mean, right, so we can trim down medical education and we can improve medical education, but again, there's so much money to be made in medical education that they don't necessarily want to, rock the boat. Right. We want to kind of keep things the way they are right now. So adding some of the stuff that, Ali's talking about and trying to expand the knowledge, that's why the courses that I do teach are outside of medical school. You literally have to graduate and then you have to get some money in your pocket and pay back some bills before you can somehow, unfortunately, come and take my courses.
Right.
But that's the way it is.
So what other, let's talk a little bit about, more about I hate to use the term alternative medicine or the, what is it, CAM, which is, CAM. Yeah, complementary
and
alternative medicine. Yeah. So acupuncture is what got you started to integrating those two. Then what else? What other things do you want to mention that are worthwhile for people to know about as a another alternative kind of approaches that you use in your practice that you found results?
So the other thing that I do several things, but the two that I teach, and I feel that I have a pretty strong grasp on, are medical acupuncture and prolotherapy. Prolotherapy actually started in the United States back in the late 40s and 50s by a guy named Hackett. Hackett was a surgeon who worked for the insurance industry, and he had people that were coming to see him that had been in motor vehicle accidents. And you have to remember, back in those days, we did not have headrests, right? So when someone was involved in a motor vehicle accident and their head went back, it didn't go back against the headrest. It actually snapped back and forward and back and forward. Right. And that was called whiplash. And patients would come to see Hackett at the insistence of the insurance examiner because they were continuing to complain of neck pain. And Hackett, after seeing so many of these people, theorized, after taking x-ray after x-ray after x-ray and finding that the x-rays, the bones looked okay. There was no fracture, there was no dislocation. So he theorized, well, their chronic pain must be because the soft tissue around the bones got damaged. And that's the source of the chronic pain. Makes sense. He started experimenting and appreciated that the connection, the weakest link in the connection of a muscle to a tendon, or a tendon to the bone, or a ligament which connects a bone to a bone, those connections are called the enthesis. And that's the weak link. So when you get an injury to a muscle, tendon, or ligament, it's the end connection to the bone that is the weakest link, called the enthesis, and that's where the pain generator is located. So he started injecting different types of solution into the enthesis. And lo and behold, he found that people were getting better. Now, this is a time where, you know, we don't have the sophisticated technology. We don't have the sophisticated needles and syringes. You know, he was using glass syringes with needles that he had to sharpen, and, you know, big needles, not small needles, but big needles, right?
Right.
That he had to sharpen and sterilize and put back into patients over and over again. Anyway, the bottom line is Hackett started using different kinds of solution, and he found one solution in particular, which, believe it or not, is dextrose, sugar water, worked incredibly well. To understand that, let me see if I can get this thing out again, because this is kind of important to appreciate the pardon me for a sec. Let's see, I can put that there. Can you see that?
Yep. Yep. Now I see. So we're looking at a muscle skeleton image of a human body.
Let me. So if you haven't seen this particular.
Oh, I see. Okay. Mm-hmm.
If you haven't seen this particular. This is called. Let's go to the knee, because it's a very common site of problems. So if you look at the knee, there
it is. Perfect. Yep. Mm-hmm. So
Okay.
I'm looking at the knee and the structure of bones and ligaments of the knee.
Exactly. What color is that?
Well, it's kind of whitish.
It's white.
Right.
Sorry, I'm trying to get it
Yep.
focused for you.
Yep.
It's white. And the reason it's white is because it doesn't have any blood supply. It has very little blood supply.
Right.
Yet the tissue around it, here is the muscle that's going into the bone, into the area. And let's see if I can focus it. I think you and I could have done a better job at some point. But as you can see, look at how the muscle is attached to the joint. And again, it's white. And that's the problem. When we injure a joint, the surrounding tissue in the joint has very little blood supply. The ligaments, they're white, very little blood supply.
Right.
The joint itself has very little blood supply. The muscle that comes down to the joint, big muscle, red, tons of blood.
Mm-hmm.
But once it comes down to the joint, its tendon is white, has very little blood supply. When we injure joints and ligaments and tendons, the reason they take so long to heal is because of that lack of blood supply.
So there's nothing to go in there and fix it and help fix it.
Correct. So what Hackett theorized was, if I take a needle and I deliver dextrose to the enthesis, the connection between the tendon and the bone, the ligament and the bone, or the cartilage in the bone, and I put in this dextrose, the body's going to say, what on earth is this high concentration of dextrose doing there? And the body, through osmosis, is going to allow sera. Sera contains a number of different repair products in it. Through osmosis, the sera is just going to percolate very high concentration into that area to get rid of the dextrose. The side effect of that is that it repairs the tissue as it's getting rid of the dextrose.
Very interesting.
So the dextrose is essentially used as a decoy. And he showed this at an AMA conference, and he happened to get a lot of people that were interested. And one of the guys that was interested was another surgeon. And this surgeon was a guy named Hemwall from Chicago. And so Hackett and Hemwall became kind of the two leading proponents of this technique, which it was initially inappropriately termed sclerotherapy, because what they thought they were doing is they thought they were creating a scar, that they were damaging the tissue and then causing it to heal. But later, after study, they found out that they were actually causing a proliferation. They were actually creating new tissue. So that's why it went from sclerotherapy, which is still being used for some indications where they create scar. It went from sclerotherapy to prolotherapy. And prolotherapy is proliferation therapy. Now, I'd like to bring your audience up to speed with some of the things that I'm sure they're hearing about. In the last probably 15 or 20 years, people have not heard any longer about prolotherapy. It's kind of gone by the wayside because they hear about stuff like PRP, platelet-rich plasma. They hear about stem cells.
Right.
They hear about amniotic fluid cells. They hear about fat cells. They hear about all this other stuff that is actually now being used. And these things have to be manufactured. It takes money, it takes time. You have to have centrifuges, you have to have special equipment. And guess what? Those manufacturers go out and promote the doctors that use their techniques for harvesting the different products that are being injected into the body.
Right. So we're back to the model of monetizing the
exactly
the solution.
It's what happened with the Flexner report, if you will, all over again. So what's happened is that although prolotherapy started it, and it's still around, it's still cheap, relatively speaking, and it's still effective, it has taken a huge back seat because the technique is still prolotherapy. It's what you're injecting that is different. So if you're injecting PRP, you're still doing prolotherapy. It's proliferation therapy. If you're doing stem cells or amniotic fluid, you're still putting in a proliferant. It's still prolotherapy, but they're distancing themselves from the term prolotherapy because they don't want to have anything to do with it, because they don't want the competition from someone finding out they can go over here and have this guy inject dextrose into them for a fraction of the cost that it to do PRP or stem cells.
But is the efficacy the same, or I mean, with stem cells, and again, I'm barely know anything about it, but my understanding was that the stem cells, being sort of like universal cells, which can form themselves into whatever is needed by the body, they would have better healing properties than actually, dextrose doesn't do over there anything other than just being like an adjutant that makes the body going in and focus on fixing the area anyway. So, but the body does the work anyways. Okay, well.
Yeah, well, no, I mean, no. Your question is on track and it's very legitimate. There's a few issues here. So stem cells are called the, if you will, polypotent cell. They can basically become any cell you want in the body by putting it with neighboring cells that are of
that's my understanding.
Right, of a particular cell line. So in theory, you should be able to put it in the liver and help grow more liver cells, as an example. The problem with stem cells are, there are a number of problems with them, but the general problem with stem cells are that the concentration that you get comes from taking it out of a person's body. So you have to extract it from the person's body. Unless you're buying stem cells that are coming from amniotic fluid, which, depending on where you are, may be legal or illegal, or you're getting stem cells that are not the patient's own stem cells. In general, people are taking patients' own stem cells because then we know there's not going to be any kind of reaction, and there shouldn't be reaction with stem cells anyway because they don't react or they don't stimulate the immune system to react. That's one of the good things about them. But the problem is the stem cells come out of, the majority of stem cells that are being used are coming out of fat cells. Now think about it. I'm 61 years old and I've got some love handles over here, and someone's going to go into my 61-year-old love handles and yank out a bunch of stem cells that have been sitting around in there and then turn around and inject them back into me at a higher concentration.
Right.
Now, how effective is that? Well, the problem is that we don't really have the data as yet to suggest that it's that effective. I've had, unfortunately, patients that have gone just down the street from my office and they've spent $5,000, $6,000, $8,000 on stem cell treatments, and that's one treatment.
Wow.
They've spent that much money, and obviously, if you're going to spend that much money, you're expecting that you only need one treatment. And they didn't get better. So that's the point I often make with them. I'm like, okay, well, you could have spent $300 and gotten one Prolo treatment with me, and you could have seen if you got better or not. If you got better, then okay, we're moving in the right direction.
Right.
If you didn't get better, then you only spent $300.
Right.
And that's been my argument forever. But people are still, they want that brand new, right off the showroom floor Mercedes Benz, and I'm going to pay that $1,000. It's like, okay, all right, knock yourself out. PRP, on the other hand, platelet-rich plasma, that actually has a lot of credibility. And it's got a lot more, it's been around longer, and it has a lot more, well, it's not been around as long as dextrose Prolo, but because of the fact that it is a manufactured, it involves a manufacturing process with particular tubes that you draw the patient's blood, spin it down in a special centrifuge, then you have to take the products apart and concentrate it and then inject that into the patient. Because it involves all of that, there's a cost. Right. And there's a manufacturing piece. And so that's 2 or 3 times the cost of standard dextrose Prolo. So you've got dextrose Prolo that's several $100s. Then you've got PRP that's $1,000 or $1,500, and then you've got stem cells that goes into the thousands and thousands. And that's, for me, I think it's unfortunate that people don't have this understanding, and
Right.
because I'm not going to sit there and get on television and try to promote dextrose prolotherapy. It's going to cost me $50,000 to get on television for 2 minutes, and I've got these people up and down the street promoting, for hundreds of thousands of dollars promoting stem cells and PRP. I can't go up against that.
Right.
So,
Well, hopefully
at my
people
local-
discovering podcasts like these, where you have the platform, where you have the time to explain things in detail, which I appreciate, because that makes me at least knowledgeable enough to make an educated decision to start with something should I need to, even as a diagnostic, to see if something else would work or not. So that's valuable in itself.
Just out of curiosity with podcasts, there's obviously, this is not live. This is just being recorded.
Right.
So there would never be any way of answering questions. But it would be interesting if there was a way in
We
the
can.
podcast. Oh, we
can make that happen, yeah. And so if you want to do in the future, we can arrange for an event which we could advertise and bring enough people that would be interested in it, and then we can literally live stream this, so it would be live, and then we can literally put another box over here with people chatting and asking questions, and we can have a moderator who could pull out the most interesting questions or the most prolific questions, and then feed them to you, so to speak, for real life answer. So yeah, that's something that we could totally entertain in the future.
Yeah, that would be cool. Yeah.
So
like
so switching topics a little bit. First of all, thank you for this very. At least in my book, a deep explanation of how these things work, but still in layman's terms, so I can appreciate that. What do you see in terms of issues in our health insurance and health practices? Constantly we have these jacked up prices. Prices continue to go up. You as a physician, as a doctor, seeing this firsthand, especially in your practice, which is this integrative practice, for the lack of better label on it, where you combine your conventional medicine practice that you are qualified to do, and then you have naturopathic doctors in your office. You have other disciplines that you kind of merge and fuse in one practice under one roof. What do you see as an issue that you see proliferating in our insurance and our health as a nation? Health planning, health dealing with our health. Can you paint the picture from your perspective? I think that would be very valuable for people to see what a doctor has to say on how these mechanisms and everything kind of fits in place and how it affects your practice.
Yeah. Well, the big problem that we have in the U.S. is that we don't have a national healthcare system. What we have is health insurance, and health insurance is no different than car insurance. You have car insurance companies out there that are vying for your business, and they're offering you bells and whistles. And one offers you, a 1-800 number, and they'll come and tow your car when you have a problem, et cetera, et cetera, et cetera. Health insurance is no different. You have huge corporate entities that are part of the medical industrial complex that are vying for your business. Cigna, Aetna, Blue Cross Blue Shield, these huge corporate entities that have shareholders that they are beholden to are out there every fall during what's called open season, trying to get more people on their insurance rolls.
Right.
What we had at the time of Obama came in and created what is known as, a universal requirement for health insurance in the United States. And it's mislabeled Obamacare. It's almost as if he created some sort of health plan for the nation. He did not. All he said was everyone needs health insurance. That was it.
Right.
And in order to do that, these big health insurance corporations had to come up with plans that would help cover all the people in the US that did not have coverage. And in order to pay for that, they said, we're going to have to jack up everybody's premiums, because some of these people, you know, they can't afford to pay.
Right.
And so we've
Somebody's
got to somehow, somebody's got to pay for it. So,
right.
you know, you've got a job, so I'm gonna make you pay more money for your premium for me to cover this guy who doesn't have a job, or, you know, whatever the problem happens to be. The interesting thing is that I don't remember the year that Obamacare originally passed. Maybe it was 2012. It didn't actually go into effect, I think, until 2014. But the insurance industry immediately, from the time it passed, they started increasing our premiums, and they haven't stopped.
Naturally.
Every year, they continue to go up. So I say to myself, well, geez, man, how is it that the insurance industry now, for if it passed in 2012 and they started jacking up prices, so we're talking for 8 years, the insurance industry has been jacking up people's premiums to the point now that people can't actually afford to go get health care from a doctor, because they will have to pay $5,000, which is their deductible, before the insurance kicks in. In the old days, your deductible was $250, $300, $400, $500. If you had a really high deductible, it was $1,000, maybe $2,000. Now you've got people that have so-called health insurance, but their deductible is $5,000, $6,000, $10,000 before the insurance company kicks in.
Right.
Now, honestly, ask yourself, what knucklehead is going to go out there and dump $5,000 or $6,000 a year waiting for the insurance company to ultimately kick in and pay a few $100s?
Right.
It doesn't
Makes
work
no
that
sense.
way.
Right.
You're paying all of your insurance costs. That $5,000 is more than, you know, probably 2 or 3 or 4 years of the cost of any care that you would be getting if you were to go to a doctor 2 or 3 times a year.
Right. And pay out of pocket.
And pay out of pocket.
Yeah.
And that's why, unfortunately, or fortunately, that's why this concierge business has come around. Concierge medicine is this, I don't agree to it, but it's getting doctors on retainers. So I prop myself up as some great doc, and I'm going to say, Adrian, if you want me to be your doc, I will be your doc 24/7, 365. You can call me anytime you want. If you need to come and see me, you can come in anytime you want. I'm your man. But every year, you're going to have to pay me $3,000 on January 1st of every year. And people are doing it because they're like, well, shit, if I've got to pay $5,000
Right,
as my premium,
right,
why the hell don't I just take $3,000 and give it to this knucklehead, and I basically have a slave. I can go see him anytime I want. I can call him up on the telephone and say, hey, dude, bring me some, bring me some, I don't know, aspirin. That's concierge medicine. Now, I mean, I'm being very facetious here, because what they're now trying to do in concierge medicine, in the 20 years ago when it first started coming about, wasn't that terribly popular. Because of all these changes in healthcare, it's become more popular. And as it's become more popular, these companies, these concierge, because concierge medicine is big business. You've got business people running healthcare. I just got a request to come for a free $200 dinner at, I don't know, somewhere in Virginia, the Ritz-Carlton or something, just to hear the pitch from a new concierge company.
Wow.
All right, just to hear the pitch. You know, impressive. $200 dinner. So I'm like, okay, let me get this straight. You're giving me $200 just to come and sit down and hear your pitch. Where'd that $200 come from?
Right.
And how many doctors are going to come and sit and hear that same pitch? That's a lot of dough, man. Well, where's it coming from? It's coming from this concierge business. And just as with the manufacturing, we were talking about the Flexner report and the pharmaceutical industry, and now with PRP and stem cells, this is a manufactured healthcare service system. And in that healthcare service system, they give you bells and whistles. So some concierge practices will say, well, you know, we have the latest technology to help you with your heart disease, or we have the latest technology for examining your peripheral vascular disease, or we've got DEXA scans. All our doctors use DEXA scans, et cetera, et cetera. So they're creating a healthcare model.
Right.
And you as a clinician have to buy into it. You have to say, okay, I'm in. I'm gonna be your man. You're gonna come in and you're going to franchise me. You're gonna tell my people out here that I'm the doc in the box with this concierge company, and you're going to try to drive business to me. Some of that business is my own, but otherwise you're going to try to drive business to me by saying, this doctor has the latest technology in doing blah, 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 and let us show you what he's capable of doing or what she's capable of doing. And so they are creating their own health care system, because there is no healthcare system in America. That's one aspect of it. The other aspect of it that's become popular are membership models. And that's something that I'm probably going to be forced to go to. A membership model is where you tell a patient, okay, I know you don't want to pay $1,500 or $3,000 annually to come and see me in a concierge practice. But what if I could tell you that I have acupuncture available, I have prolotherapy available, I have allergy elimination technique available, I've got all of these various complementary and alternative therapies that your insurance company doesn't pay for. But I'm willing to give it to you at a discount if you pay me upfront. So if you pay me $300 or $400 or $500 annually, $300 would be the basic, $400 would be a bit more, $500 would be the top of the line. You will get a 25% and a 35% and a 45% discount on all the services that I provide.
Right.
And that would be a membership model. Very simplified example of a membership model, but that would be a membership model. And that's actually become very popular. Again, why? Because people have these crazy deductibles and they're saying, well, shit, if I've got to pay all this money, I might as well just pay this guy $300 and get all this discounted service that my insurance company doesn't pay for anyway.
Anyways, right.
And I'm going to get a discount from this guy. And for the first time, I'm going to get acupuncture. For the first time, I'm going to get prolotherapy. For the first time, I'm going to get my allergies treated without ever having to take a medication again, just by using homeopathy and acupuncture and acupressure. So these are, if you will, again, I'm as odd as it sounds, I want to create, if you will, a healthcare program in a membership model for my patients, because I have a psychotherapist that actually trains people how to manage their care. So she does what's called MDIR, she does tapping, she does cognitive behavioral therapy, both for psycho-emotional issues, but also CBT for insomnia. I've got a medical nutritionist. I have a naturopath. I've got a massage therapist that does essentially rolfing. I have a physical therapist that does IMT physical therapy, which is a gentle manual manipulation and uses acupuncture. They call it dry needling, which drives me bananas. It's a form of acupuncture. I mean, they stole it from acupuncturists. I let him do it because I respect him, because he's a damn good physical therapist. But it's at the end of the day, dry needling is acupuncture. It's a form of acupuncture, and they have no business practicing it, but they do. And then I've got an esthetician. So I've got all of these additional services that people really can't get, because in the conventional model, they don't have access to that.
Right.
And so why wouldn't I create, if you will, my own little healthcare model literally within my office, and tell people, look, if you're 50 years old and you've got this problem and that problem, I need to evaluate you from this kind of evaluation. I mean, I would like to tell people that are 50, everybody needs to be evaluated for your capacity to detox. Most people they have no idea that they are becoming poor detoxifiers as they age, but we all are.
Right.
Look at my eyeballs, look at my wrinkles. This is poor detoxification.
Right. You know what I like about the concept and the structure that you're talking about is that it takes into account a system approach to healthcare. Typically, when you go with your standard care, you go to a specialist, or you go to your primary care, then they may send you to a specialist and so on, and you're stuck with these silos of I don't know, I looked at everything and your nose, whatever, everything is fine. You got to go to this specialist, and you go to this specialist, and another specialist, and there's no one who kind of can take a step back and say, like, well, maybe there is some other problem underlying all of this, and kind of integrates this. And to me, your practice is like one of those places that has that capability and the talent in your practice that can actually evaluate it from all those different perspectives and give that comprehensive approach, versus like, here, try this, try that, and then if nothing else works, then they come and see you because nothing else worked. It should be the opposite. It should be the other way around.
I tell my new patients that all the time, because I draw a picture. Let me get my pen and just draw it. So I tell my patients, I wish I had a clipboard.
I have a feeling we're going to be doing more of these.
So I tell my patients, we start out life with wellness. We're not designed to break down. But what happens is we go through life and some event hits that takes us off our trajectory. And we go to a well-intentioned MD, which means maintain disease. And that well-intentioned MD gives us their pill for that ill, whatever that ill happens to be. They don't give us the previous normal of wellness. They give us a new normal. And we go along not having changed our life, not having changed anything about ourselves.
Right.
We just took a pill for a symptom of the stressors that are affecting our daily life. I'm taking a pill now for my chronic daily headache. And the pill keeps the chronic daily headache until now, suddenly, 6 months later, 8 months later, a year later, I start getting shoulder pain. I go to another well-intentioned MD, and he maintains my disease by giving me yet another pill for my shoulder pain. And I go along for another 8, 6, 10 months with not the original wellness, but a new normal, until the next symptoms comes out. And I pick up the next MD for that particular problem, whatever that particular problem happens to be. And we collect these MDs. So by the time you're 75 years old, you've got 6 or 7 MDs and you're on 6 or 7 pills.
Right.
And none of these pills are designed to cure your problem. They're only designed to take the symptom away from your consciousness.
Right.
That's it. So if you stop taking that pill, the symptom comes roaring back. And our practice is designed actually as a lifestyle modification practice. We train people, we teach people about this stuff. And we give them options. We give them different ways to manage this. Now, again, I'm not cavalier. If a patient needs a medication, I'm going to give them a medication. But if they're open to looking at, again, I hate to use terms like alternative or complementary, but if they're open to looking at other options, at least we are a practice that can provide that. They don't have to go and say, okay, well, how do I find that? Well, go Google it. You know, good luck with that, but go Google it. I don't know. So that's my intention. That's my hope, that we will, as we go forward, at least in my practice, that we're going to be able to come up with some good quality, evidence supported techniques and, if you will, evaluations for our patients for different phases of their life. Because a huge problem is that we, again, I'll go back to using the concept of detoxification. I mean, think about it. We start out life as empty containers, but we get exposed on a daily basis to air that we have absolutely no idea where it's coming from. And we have no choice but to breathe it. Same thing with the food. We have absolutely no choice but to eat it. Now, it tastes good. It may be expensive. It may have come from the best restaurant in Washington, D.C., and you know, and the chef is world renowned. But the bottom line is, still, you have no idea where that food came from. You have no idea how it was prepared. And you have no idea what's in it. And yet we eat this stuff and we breathe this stuff on a daily basis, and we happen to live, although our life expectancy is going down in America, we happen to live for 75 years. Now, we should be able to push that out. We should be able to push that out by improving our environment, not destroying it, but we're destroying it. And that's a problem. That's a huge problem.
Right. So this takes us to the conversation about medical crises in U.S. What are your thoughts on what is happening health-wise? We talked about insurance and medical insurance, which is the, just a vehicle of offsetting potential cost of medical care, right? So that is that we know is has its own issues, which you described how the model works, and which forces you to, the market forces are literally impacting how your practice works. So you're responding to that by potentially creating a membership-based model that will help, in a comprehensive way, provide healthcare to individuals who choose to use your services. In terms of health itself, what do you see as like patterns? I mean, we hear about obesity constantly, right? We hear about that. So probably, poor quality of food factors into that, highly processed stuff. Mm-hmm. What else do you see in terms of health crisis in the nation?
Well, the biggest health crisis is going to hit the millennials.
How so?
The millennials. Yeah, it's going to be diabetes. The incidence of diabetes in this country is increasing, and it's skyrocketing. And millennials are that group that are going to bear the brunt of it. So that's a huge problem. If you look at, I teach a class at Georgetown. I teach 2 acupuncture courses, and I teach a basically metabolic syndrome. It's a 3-hour-long lecture that I generally try to divide up. And I've been doing that now for over a decade, and each year I add more and more slides from information that's coming out, not only from medical journals, but also in the public. And it's going to be a huge crisis. And it's multifactorial. It's just not diet, if you will. Most people don't appreciate that, and I call this the Starbucks syndrome. Mr. Schwartz, the owner of Starbucks, which he was running for president. I think did he pull out? Did he bail?
Yeah, I don't think he's no longer running. Yeah, he's the CEO of Starbucks. Mm-hmm.
Yeah, Starbucks. Now, as the CEO of Starbucks, man, he knew the body physiology better than the average physician, who'd forgotten it, because again, the problem with what you learn in medical school and what you apply on a daily basis in clinical practice, 180. It's a really? 180.
How
totally.
So?
It's the insurance industry. The insurance industry tells you how you're going to practice medicine.
So it's the economic model that forces the practitioner's hand to do one thing over another thing because of the financial incentive and just the economy of doing business.
I want to order this test. I got to call up the insurance company. The insurance company says, no, you can't order that test. But no, I need to order that test. No, you can't. You can't. Sorry. It's okay. Sorry. Bye. I had a patient. She had shingles. She's 37 years old. She had shingles. And I asked her, because the age to get the shingles vaccination is generally above 50 years old, and in most cases it's in the 60s. The new shingles vaccination, Shingrix, is touted to be about 95% effective, 95% effective. The old shingles vaccination, the longer you had it in your body, the less effective it was. So if you got it at 40, by the time you're 65, 70 years old, it's probably not that effective, but that's when you need it. So this young lady's in her, late 30s, and she's had shingles now a couple of times, and it was very uncomfortable for her. And I said, well, you need to get the vaccination. So she said, yeah, sure, okay. So I wrote out the script and I sent it, and she went to the vaccination clinic, and the vaccination clinic said, sorry, your insurance won't pay for it. Why not? Because you're not 65. What? You're not 65. You have to be 65 to get it. Really? I'm thinking to myself, 65? That's just so stupid that it's laughable, because 65, you're at the height of the potential for getting shingles. You don't want to put it in at 65. You want to put it in at 55 so that there's no potential.
Right.
But no, for this insurance company, it was 65, which clearly tells you they're doing the math. They don't want to give it to 55-year-olds. They'll give it to 65-year-olds, but they won't give it to 55-year-olds, because how much more population are they going to be having to put money out into to get them covered? So we're going to do 65 and older. So I had to call.
Mm-hmm. So pure economics driving. So it's pure economics driving the practice of medicine.
Well, that's what I would argue. Of course, they're not going to argue that. They're going to say, "Oh no, we've done studies, and we've got legitimate evidence-based information to suggest that this is when it should be done. And they're going to make up all kinds of BS in order to substantiate why they won't pay for anything, right? So in her case, I get on the phone, I spend half an hour on the telephone with some yahoo that I have no idea what their clinical background is. And all she was doing, and I'm not shooting the messenger here, I'm just telling you how it went down. She was clearly reading a script. In order for your patient to be eligible to have the Shingrix vaccination, they need to be 65 years of age or older. And I said, but she's 37 and she's had 2 episodes of shingles, and it's really uncomfortable. This is inappropriate. You're the insurance company. You need to go. In order for your patient to have the Shingrix, and I'm like, oh my God. I'm like, what are you, a robot? Sir, is there anything else I can do for you?
Wow.
Half an hour of this BS. And then I just finally hang up. So this is the sort of thing as clinicians we deal with on a regular basis. So the point I'm making is, again, going back to the original point, which was simply what you learn in medical school and what you apply in clinical practice is 180. You know better, but you can't apply it because you're not in the driver's seat. The insurance industry, the pharmaceutical industry, big business, big government, the industrial medical complex is in the driver's seat. You are just a cog in the wheel. And many times people like me, we're actually a thorn in somebody's side, and they'd rather get rid of us than to try to help us. So, but that was a preamble to talk about Mr. Schwartz and Mr. Schwartz.
Back to Starbucks.
Yeah, he had the physiology down, and this was in relationship to metabolic syndrome and how the next, if you will, devastating illness that's going to affect the population of the United States is diabetes, and it's going to hit primarily the millennials. When you get up in the morning and you don't necessarily eat anything, your body's going to want to get some sugar into it because sugar is essentially our fuel. So it'll break down a little bit of the sugar that you might have. When you don't have enough of that sugar, you're going to be tired, you're going to be run down. If you didn't sleep well the night before, you're going to be tired, you're going to be run down. So what are you going to do? You're going to get a coffee. So when you get that coffee has caffeine in it, and caffeine drives your adrenal gland. It increases your cortisol, your stress hormone output. When you increase your stress hormone output, cortisol, you get cravings. And the 2 major cravings you get are sugar and salt. So what is the ultimate side effect of too much sugar? Diabetes. What is the ultimate side effect of too much salt? Hypertension. What does that combination create? Cardiovascular disease. So Mr. Schwartz had it all figured out. He's like, if I can put at the beginning the coffee, and as soon as they smell that aroma and start the salivary juices going, they're going to start craving, because it's the same cascade, they're going to be craving either something sugary, so I'll put a nice, juicy, sticky bun, or they're going to be craving something that's salty or savory, so I'll put maybe some bagel and some cream cheese or something further down the line. And by the time you go through that line, you just spent your $12, your $15 on your first hit of the day.
Right.
And that drives your sugar up, which then spikes your insulin to try to bring the sugar down. And it takes 3 or 4 hours to bring the sugar down. And then once it drops down far enough, that's when that urge kicks back in and you visit your Starbucks for the second run of the day. And people do 2 runs, sometimes 3 runs to Starbucks, and they maintain this. And over time, you end up getting what is considered insulin resistance, where because of the sudden spike in sugar, your pancreas has to give an additional sudden spike of insulin to try to chase the sugar down.
Right.
Over time, your body becomes resistant to that insulin spike. So now you got the sugar going up, the insulin goes up, but it's not high enough now because the body's become resistant to it. So the body's got to make more insulin. It's got to make more insulin. It's got to make more insulin. That's called insulin resistance. Insulin resistance is the hallmark of metabolic syndrome. Metabolic syndrome is the #1 cause of cardiovascular disease in America today. And insulin resistance is the precursor to diabetes. And that's what we're dealing with in this country with the millennials. And they're going to be hit pretty hard. At least that's what the statistics show.
Right.
10, 15 years ago, they estimated that something like 40, 50% of the US population was going to be either pre-diabetic or diabetic, pre-diabetic or diabetic. Well, we reached that about 5, 6 years ago. So we've got a huge diabetic crisis. And that's just in America. We export this crap around the world. So just imagine in Central America and South America, where you have the indigenous Indian populations. So if you look at the migratory habits of man, when the Indians, if you will, came across the Bering Straits when it was ice, and then started populating Alaska, and then literally coming down the spine of North America into Central America, and then into South America, that indigenous population have a beautiful capacity to tolerate long periods of without food, without water, and they could sustain themselves because of their migratory habits.
Right. And
they moved. Those people moved, right? Those people moved. They built things. And
so active.
Very active. But then you take that population and you make them sedentary, and then you take that population and feed them the junk food that we are absolutely exporting around the world, which is just laden with sugar. And those people suddenly develop massive obesity, insulin resistance, diabetes, hypertension, and cardiovascular disease. If anything is going to sink Mexico, it's going to be diabetes. Wow. Because the indigenous populations are so predisposed to gaining weight when they're sedentary that and there's such a high population of of indigenous people in Mexico and in Central and South America in general, but in Mexico in particular because of the size of the country and the fact that there are a number of indigenous tribes there. They've got a problem. They've got a problem. So.
What are your thoughts? You mentioned the something that's kind of near and dear my heart, which is fasting, and specifically water fasting. So fasting basically just on water. I just finished actually 6-day water fast, which typically makes me feel great, even though I kind of have some practice in that respect because I've done it several times, so I kind of figured out what works best for me. And I do it as a matter of kind of, I don't know, cleansing of the body and trying to get away from any kind of cravings. It's funny how your body kind of switches from sugar as a source of quick energy to kind of tweaking your own machinery. So that survival muscle that we have over here with love handles and around our waist, it just taps right into that, and then you get those ketones as feels great. And I'm just curious, like, what are your thoughts on that, and have you dabbled in that domain at all?
Yeah, well, the irony of it is, when I was in medical school and residency, and just out of force of habit, I started eating one meal a day.
Yeah. Same here. Not for different reason, not medical school, but just work-related stuff. When you just don't have the time, you eat once a day, and typically later in the day, like in the afternoon. No breakfast. Breakfast, the most important meal of the day. And I'm like, how is it more important? Like, if I eat breakfast right now, which doesn't happen very often, it's mostly like some kind of a social thing when a family sits down, like, oh, let's have pancakes or something. I'm like, I know I'm going to feel terrible. I know because my body's just like, what are you doing to me this early with this food over here? I'm doing all right. You got plenty of energy in your body.
Yeah, I don't. This idea that breakfast is most important. It's in my opinion, it's nonsense. Total nonsense. I mean, I think you should feed your body when your body wants to be fed. And this idea that somehow I'm going to sit down and force myself to eat something when I'm not hungry, I just think it's just nonsense. Or eat something that doesn't even look appetizing or appealing to me, but because it's breakfast food and breakfast is the most important meal of the day, I'm like, no, I don't want to eat that. Leave me alone.
Right.
But just because out of necessity, I started eating one meal a day. And that was primarily, in the evening, anywhere from about 5 to 9 o'clock. Now, granted, I mean, I've got a massive appetite. So when I ate that meal, I mean, I was packing it.
Yeah.
But I did that for a good 20, 25 years until I met my significant other, who's a vegetarian of 25 years. And all of a sudden, in the last year of being with Natasha, and she's a very good cook and she likes to experiment, but it's, as vegetarians, they do have their proteins, but there's a considerable amount of carbohydrate. And she always insists that I eat something for breakfast and something for lunch and something for dinner. And we have a baby, a 7-month-old baby. So besides the pregnancy weight that I put on with her, the sympathy pregnancy weight.
The sympathy, yeah, absolutely. I'm with you.
And sympathy. And well, that 2 o'clock in the morning bucket of ice cream, she's having some, and I thought, well, all right, sure, I'll have a couple.
I'll do it for you, honey.
Honey, I'll take one right here. But then also eating her food. Right. So now, she wants me to have breakfast, lunch, and dinner. I mean, I've put on like 12 pounds, and I'm like, and I keep telling her, I said, no, I'm going back to the way I used to eat. I don't want breakfast. I don't want freaking lunch. And I just want to eat dinner. That's all I want. Right. And she said, well, what kind of dinner do you want? I'm not going to cook you meat. And I said, okay, I don't want meat, but I definitely don't want it carbohydrate laden either. I mean, just give me a little bit of your, I don't know, some dal or something like that. No, I don't want bread. I don't want rice and a salad. She goes, no, that's just not enough. And I'm like, oh. So anyway, there's a little bit of frustration there. But that was a long answer to a short question. I think intermittent fasting is absolutely critical to our health and well-being, because that's actually how our ancestors lived.
Yeah.
They did not have 3 meals a day. They did not eat all the time. They didn't sit around the frickin' campfire and, eat their Pop-Tarts at, 10 o'clock at night before they went to bed. I mean, they didn't have it like that. And we do. And unfortunately, as a result of that, we are suffering the consequences. Can you imagine what healthcare would be like if we actually ate properly, if we had proper food, if we had proper diet, if we didn't have stress in our lives? Can you imagine how healthy we would be as a society, and how accomplished, and what we could, besides thriving in our well-being, our productivity and what we could do as a nation would absolutely soar. But we're sitting here dicking around with this god-awful food. I mean, I every 6 weeks I'm flying somewhere to teach, and I'm sitting there in every single airport in the United States, and I'm trying to find something healthy to eat. And I go from one place to another, to another, to another. It drives me bananas. I mean, there's no place that you can sit down and get something that's of some reasonable quality. Now, I see it more and more and more. There are places that are creating, better food choices. But by and large, the people in general still, I was at O'Hare last week on a Sunday night at like 11 o'clock at night. There were 3 or 4 restaurants that were open. The one that had the line in front of it was frickin' McDonald's. I mean, it had a line. It had like 30 people in line. And I'm just
what a shame. Wow. What a shame.
I'm like, that's
people will
crazy.
People are literally eating themselves to death.
Yeah, no, we are. Absolutely, we are. And, the other aspect of it is that because we have such job insecurity, and the fact that there's very little reward for many people in their job, at the end of the day, people seek reward. And how do we seek reward?
A little comfort food, a little treat for myself, my worries, for my stress of a day.
Yeah, exactly right. And some people do it with food, some people do it with alcohol, some people do it with drugs, and it just becomes a mess. And these are things that our society, an intelligent society that has the capacity to understand this and to provide something better for its populace, we're just not. We just don't have the interest. There's no money in it. It means it means that we are going to have to change so much. We're going to have to change the food delivery system. We're going to have to change the way we think about the job stress, the way we actually think about how people in the workforce are supposed to work. I mean, it's just, I know a number of the top folks at Motley Fool, and I've gone to their headquarters in Virginia on a couple of occasions and delivered some lectures. And I was always impressed at not only the workplace, it's basically open seating, windows everywhere, light everywhere. And you can sit here and you can see through, 15 people's offices because it's all glass. Right. You got standing desks and you got sitting desks. If you're tired of sitting, you stand up. Everybody's got an ergonomically tailored workstation.
Right.
And they've got vending machines that are coming from Whole Foods. Whole Foods comes in and puts all of the products, fresh stuff, into their vending machines. They got the crap vending machines too. They give you choices. So you can have the crap, or you can have, they've got people that do seated massage. They have a meditation room. So they've got these amazing, and you don't, as an employee, you're given incentive to do those things, but you're not forced to. Right. So you've got the option, right? And I just thought to myself, if industry could adopt this kind of well-being, what would be the productivity of industry as a whole? Because I'll tell you what, Motley Fool is burning it up. I mean, they are burning it up. I've seen them over the last 20 years. I've known these guys for 20 years, and I'm thoroughly impressed at what they've been able to create.
I mean, they realize that this is an investment in their workforce, and it directly translates into the product that they are able to produce. And so
Absolutely.
It takes a person with vision, it takes a person with understanding what it takes to transform a workplace in order to optimize it. And I like what you said, that, here's an option. And what I believe is that people recognize what's good for them, and they will mimic other people that, like, hey, wow, you're looking good. You lost some weight. I see you're energetic. Like, what are you doing? Well, I started doing these couple of simple things. I don't eat breakfast. I stay away from sugar, and I try to stay active. I stand in front of my desk more than I sit, and all these different things just kind of connect, and people see, like, wow, okay, I'll give it a try, right? And then they have an office that supports that because it's there, right? So you have an option of instead of like a vending machine that has just like sweet stuff, and you're like, oh man, I just feel so tired. Well, what am I going to do? Well, I'm going to have a Snickers bar and load up on sugar, right? And boom, I feel great for like 30 minutes, and I feel like crap, and rinse and repeat.
Yep.
So,
yeah, it's insane.
So it takes awareness. It takes social change that will take time to. But let's get back to your practice and to what you're doing. I love this conversation. I think we've been talking for nearly 2 hours, so it's been a while, but it's so fascinating. I think we can probably peel off over here and do another one because
Sure.
we probably have we definitely have additional things that I'd like to cover, and some of them as a teaser to our audience. I think all the other practices that you mentioned, some of them, I talked to one of your practitioners, Dr. Karen Threlkel, who's a naturopathic doctor, and she's been educating me with how, given what your body needs, your body is such a wonderful machine that can fix up itself. Just if you remove the things that it doesn't, the crap that it doesn't need, and you give it what it needs, and poof, miraculously, it can do a lot of legwork to fix up itself, right? So
yeah, absolutely. The other, I should probably introduce you at some point to the other practitioners as well.
Yes.
So if you ever want to interview any of them,
absolutely.
I can put you in touch with them. It would be interesing.
So who else?
Yeah,
let's just kind of run through the list of other practitioners and briefly, what do they do, and how are they part of your whole practice?
So Olga is our medical nutritionist, and it's been really dynamite working with her because I still take insurance. I've been able to, because I still take insurance, I've been able to bring her on as my associate. And so I can actually now have all my insured patients be seen by a medical nutritionist. So now all of a sudden, every single patient that I have, I give them the option. I say, your cholesterol is elevated. Your weight's a little over what you would like it to be. Your blood pressure is elevated. Why don't you go and sit with Olga and talk to her about what you eat and see whether or not there's something that she may be able to afford you that would be helpful, that may resonate with you and may help with lifestyle change. And the biggest problem I think we have as a society and as human beings in general is that change for us is very difficult. And the reason we have a 40 billion diet industry every January is because of the fact it's called a diet. And by definition, a diet is a period of time.
Temporary, yeah.
Exactly. It's not lifestyle modification. So Olga, in my practice, is talking about lifestyle modification. She's not talking about diet. She's talking about what are you going to do that's going to sustain you for the rest of your life. That's something that you'll be willing to do on a daily basis so that you'll incorporate it into your health and well-being. So that's what Olga helps me out with. And she uses a number of different, if you will, dietary modifications. I use that term again, but I don't know what else to use other than to call food modifications. I don't know. So that's Olga. Then we have Annie Miller. She's our psychotherapist. She uses rapid eye movement desensitization technique. And that's very helpful for people with a number of problems, but people that have had PTSD and people have had fairly significant traumas in life, that's very, very helpful. She uses a technique called tapping, where we tap different acupuncture points on the face, and in a certain order, and putting a positive thought into that process as well. And that's been around a long time. You can Google tapping, and I mean, there's some pretty amazing stories out there on the internet with tapping. She also does cognitive behavioral therapy, and one of the very interesting things that she uses cognitive behavioral therapy for is cognitive behavioral therapy -I for insomnia. I mean, she's actually taken people that have been insomniacs for 20 years. And in 6-7 weeks, she's actually trained them to sleep again. So it's fascinating stuff. And she and I are working together on a pain program for our office to try to teach people about pain and how so much of pain is psycho-emotional, and that if you can at least learn how to manage the psycho-emotional aspect of pain, you may not be able to get rid of all the pain, but you can get rid of a fairly significant portion of the pain so that it becomes more tolerable. As you know, people like to get identified by their diseases, by the labels, and we'd rather not have that in our, I mean, I tried to do my best not to label people with conditions because I don't think in the long run that's in their best interest. Then we have Olivier. He's our French massage therapist, and he does structural reintegration, which is it's a fancier form of Rolfing. Rolfing is very deep tissue work, and it's frankly very psycho-emotionally driven. People that get Rolfing or this deep tissue work will have emotional releases because our body does retain memory in our tissue, and he's an excellent therapist. And then we have Scott, who is our physical therapist that does IMT, Integrative Manual Therapy, which is a lot of very gentle hands-on work. And he also does dry needling work. It's very, very interesting stuff. He helps retrain the body. He'll watch people walk up and down the hall, for example, and then he'll put bands on them to change the way their gait or their shoulder or their back or their knees, if you will, the way their walk is modified by these bands is pretty impressive. Right. And they do it enough that it retrains them. So
interesting.
These are some of our therapists. They're very interesting people, and we should if you're interested, I'll get
definitely
you in touch
explore.
with them.
Yeah, I'd love to. Well, I already am on second episode with Karen
right.
Frelkel, so you gotta catch up. But I would love to talk to your other staff and learn more about what they do. And sure. I really enjoy this. You are a refreshing representation of a medical doctor who's doing something that I hope is going to catch on, and I think the market forces will be driving more and more of like other practitioners to go, and I hope in your footsteps. I'm glad to hear that you're teaching a lot of this stuff, and we're going to talk probably about that in the future as well, about what you teach and and I hope that this is going to catch on, because this kind of comprehensive thing that you do with your practice, I think it's the way forward, instead of these siloed approaches that people are used to. Instead of having a pill mentality, having a lifestyle change mentality for people, I think it's key. So we touched upon those topics, and I am curious about, but that's going to be for the next episode, your thoughts on some of those things that are kind of touchy subjects in terms of like the cholesterol levels and statins and some of the dietary stuff. But I'll probably talk to Olga about that as well, because I'm exploring different types of not even diets, but like ways of feeding your body, and what are some of the experiences that you have with some of your patients. I personally don't think that there is one size fits all. I think that everybody should experiment a little bit with their own body in terms of what their bodies work with best, but there are some, I think, universal truths that kind of are a common denominator across the field, like how our bodies should be fed. And I think one of them is, like we talked about, the intermittent fasting, skipping breakfast. Like you mentioned, our ancestors weren't fed 3 times a day, square meals and all that stuff, right? And like, they were not eating like gazelles. They were not grazing all day long. They were eating when they had food, and they were fasted. They were fasting when they didn't have food, and they were feasting when they had food, and that's how our bodies kind of developed around that. So we'd definitely love to talk about that some more.
And I'll leave you with an example. I had a 17-year-old in today with her mother, and she's got anxiety, very sweet kid, very bright kid, but her biggest issue is anxiety. She has headaches. She's got a lot of stress, if you will, in her body. Straight A student. And so I said, well, what do you do for fun? She goes, I love my bed. And I said, does that mean you're tired? And so you want to lie down and sleep? She goes, no, I just love sitting on my bed and reading, or, working on my computer, or watching television. I just enjoy sitting on my bed and being at home.
Right.
And then I talked to her about it, and I said, and this goes back to acupuncture. I said, what's your favorite color? And she said, blue-green. And I said, okay. And I said, what's your favorite season of the year? And she said, spring. And I said, okay. And so I asked her a series of these acupuncture-related questions, and she fits a circuit that's called Zhui Yin Xiaoyang. And these people are full of basically kinetic energy. And if this kinetic energy cannot be released, it stays within them and it chews them up. So they get anxious, they become very irritable, they become moody, they become depressed, they have bruxism, where they chomp on their teeth, they get TMJ, they get tension headaches, et cetera, et cetera. And so after I asked her those few questions and described these additional symptoms, and she kept saying, yes, I have that. Yeah, oh yeah, I forgot to tell you that. Yes, I have that. Yes, I have that. I turned around and I said to her, I said, I'm 61, and when I was your age, I didn't sit on a bed. I would come home, I'd take off my school clothes, and the first thing I would do is run outside in the grass. Yeah. And I would like climb a tree. I would shoot hoops. I would run around with my buddies in the woods, and all that frenetic, kinetic energy would be discharged. Released. So by the time I came home, I was calm. Beat.
Yeah, and you go into sleep and you fall asleep instantaneously.
Right.
Yeah.
And today, these kids don't have an outlet like that, right? They sit here on this thing,
right?
And then they sit here on this thing,
right?
And then they've got this thing connected to that thing,
right?
And it's all happening at the same time on her bed. And she's feeding this energetic, toxic soup into her body that she's unable to dissipate, because she's not doing anything. And then she wonders why she doesn't sleep. She wonders why she's anxious. She wonders why she's got a headache. I mean, it's amazing how we're doing that to our kids in our society. But, you know, this is we can't live without this stuff, right? I mean,
right.
This is it.
Our phones and tablets own us.
Yeah. Anyway.
Well, Dr. Safayan, thank you so much. This was very refreshing to have someone. I'm so glad and privileged that we had a chance to talk about, and I want to continue this, and we're going to come up with some topics. I'm going to be looking forward to talking to you again. I would love to continue this conversation, and maybe we'll set up a live stream in the future where we're going to have some people connect and ask questions, and we will continue this awareness campaign.
Yeah, I think the other thing that would be ideal if I either fed you some of these pictures so that you could have them.
Yeah, and
that
can just put them on the screen. Yeah.
Yeah, and or I would have some sort of, you know, a drawing board, and I'd draw it, and I mean, I don't know how we'd zoom it, but you know, we could work all that.
Oh, we can figure out technology. Great.
Cool, man.
Well, thank you.
Adrian.
Until next time. For those who want to find out more about Dr. Ali Safayan's practice, here in the title over here for him, you have restorativehealth.org is the website where you can find out more about his practice, about his staff and other practitioners in his practice. And he is located in DC area, right? Is that correct?
Yep.
And for those of you who are lucky to be in proximity of his office, you have the option of going and seeing him. For the others, you're going to have to lean on this podcast to get some of your education and then some of the resources on his website. And I'm looking forward to speaking to you again, Doctor, in the future.
All right, man.
All right. Thank you,
Adrian.
All right. Have a good night.
Bye-bye.
Apodcast.com. Listen, learn, and share.
Thanks for listening to a podcast with interesting people. If you like this episode, please subscribe and leave a review or comment.
And support us by sharing our episodes on social media. We really appreciate it. And for more information, visit us at apodcast.com. Thanks.
Thank you.